If your client's tailbone pain keeps returning, there's a reason. And it starts with an overlooked connection that most pelvic health therapists don't know to look for. In this episode, I walk you through the sacrum sphincter coccyx relationship that creates a functional tug of war on the tailbone. It's a biomechanical chain that most clinicians don't assess. Yet, once you discover it, you're going to find it again and again.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to this episode. And today I want to talk to you more about the coccyx. Now, I know I've done another podcast earlier, so you can go check out that one. But something new has popped into my awareness in working with a couple of my clients in the last couple of weeks. And just wanted to share this concept that is coming to me as I'm working on the body. A lot of times when I have my hands on the tissues or I'm working with different structures, I kind of get these analogies or these insights that come to me. And one just came through on the tailbone. And when we're working on the tailbone, I think in the last podcast I talked about the coccygeus muscles have been the main focus of my treatments when someone's coming in with coccyx pain. And we know in childbirth that this tailbone can get a lot of pressure put on it, and some people can fracture them or dislocate them during the childbirth process. But today I want to talk about three areas that I really want you all to be assessing to help relieve the tension and pain from the coccyx. And the first one is the coccygeus muscles. They attach laterally on either side, and we need to make sure that those are nice and balanced. And we want to release the tissue tension in the coccygeus muscles. And using the Schulte hold is very helpful in helping those tissues to relax. And remember, I've talked about this in another podcast. If the coccygeus tension is bilateral and it's the same bilateral, then I'm thinking that there's more of the sacrum stuck in flexion. If there's more tension on one side versus the other side, then I'm thinking that that sacrum is in more of that common birth pattern where the sacrum is off to one side, usually towards the right side is where I find it the most. You can find it to the left, but I'm just sharing with you the common patterns that are the most common patterns that I find in my practice. And so the coccygeus is that lateral mobility side to side that we need to make sure is nice and even for that coccyx to be happy in there, to have good, even mobility. And we want to keep the tension off of that tailbone so that it can heal in a more relaxed state. What's coming to me more recently is the second area that we need to really focus in on is the sacrum and the position of the sacrum. If the sacrum is stuck in flexion, then that tailbone is at the tip of that sacrum, so it's going to be more posterior. And we need to understand that at the tip of the tailbone is the anococcygeal raphe ligament or tissue that attaches then to the sphincter muscle. And what's the new concept or the image that came to mind this last couple of weeks is this idea that the tailbone is in a tug of war between the sacrum and the anus because of this raphe, the anococcygeal raphe. And in order to take the tension off of the tailbone, we need to first address and get the sacrum out of flexion. That'll take the tension off of this entire system. And then we also need to release any tension that we have in the sphincter muscle as well. So that's the third. So the first one is coccygeus muscle tension. The second area of focus needs to be releasing sacral flexion. And then the third area needs to be releasing the anal sphincter complex. And we use the tailbone. I teach how to release all those in the holistic treatment of the postpartum body course. And I also teach another technique for sacral flexion in the advanced postpartum techniques course. And that one is just taught online. But there's something that I actually use all the time. I use that every day in that advanced course to correct sacral flexion. So I really encourage you to check that course out as well. In the advanced course, I'll also go over some advanced nervous system techniques to help calm down the nervous system too, which can be super, super helpful. So today I just wanted to share with you this concept, this idea that sometimes the tailbone is it's in the middle of a tug of war between the anal sphincter complex and the sacrum. And we need to address both ends of that to take off the tension from the tailbone. And for those of you who can't visually understand what I'm talking about here, I do have it on video. If you're listening to this podcast only through audio, you could go check out the YouTube site where I put all the video of the podcast. And I'm holding up the pelvic model so that you can see how if the sacrum is in flexion, it's going to be pulling the tip of the coccyx backwards, more posterior, which is going to put tension through the anococcygeal raphe on the sphincter complex. And we need to address both the sacral flexion and the anal sphincter complex to take off the tension of this poor coccyx that is just getting pulled both directions, anterior and posterior. And then we have the coccygeus muscles that are pulling it laterally. And we need to address all directions to help make that tailbone happier. And also know that you can also have some rotational torsions or of the tailbone, or we can have some side bending of the tailbone. And a lot of that can be addressed when we address the tension patterns caused by the open birthing pattern, caused by the bones being stuck in flexion, sacral flexion, ischial splay, and then the anus is this structure that is just kind of floating right in the bottom of the perineal or bottom of the pelvic floor, and its support structure is the tip of the tailbone via that coccygeal raphe, anococcygeal raphe. And nobody is teaching how to address this anal sphincter complex like how I teach it in the holistic treatment of the postpartum body course. And it is so effective in letting go of tension in here. And if anybody wants to see like the true effects of birth on the anal sphincter, I invite you to follow Badass Mother Birther. Badass Mother Birther. They have videos. They're all sensitive contents because they're showing how babies come on out. I would watch a person birthing on hands and knees and watch as that baby's head comes down through this pelvis and see what happens to that anal sphincter complex as that baby is coming on out. It gets, I don't know the times, but 10 times its normal length. It gets really pushed out. And I have to say, I always find knots in this anal sphincter complex after birth. And when you watch those videos, you'll see why. And this structure really needs to be addressed post birth. I see comments online in other groups about women who have to constantly wipe after having a bowel movement because they're never clean. If we have tension or knots in this sphincter muscle complex, it's keeping the sphincter muscle open, and then it never closes firmly in order for them to have a complete clean wipe. And when you release the tension in the anal sphincter complex, it can shut again. So when I'm assessing the anal sphincter complex, I want it closed. I think of it like a front door where I have to knock in order to come in. That is where there's tension in the anal sphincter muscles where it's holding it closed. That's ideal. That's normal. If I go to assess this and my finger pops in without having to knock or have any resistance, then I'm thinking that there's some tension in this that we need to need to release those knots to be able to close up the anal sphincter muscle. And sometimes when you're working on them, you'll feel the reflex of the anus closing and like, yay, that's good. We want that. And another indicator that the sacrum is in flexion is if you notice that you have increased tension and tone on the lower half of the anal sphincter complex. Because the tailbone's pulling it backwards, there's tension on that ligament, the raphe, and it's pulling on the inferior aspect of the sphincter muscle. When you bring the bone back into a more midline position, more neutral position, out of flexion, you take that tension off. We still need to release this tension in the sphincter muscle in order to get that to be able to close completely and function well for our clients to have good bowel movements. So please keep this in mind as you go to work with your clients this week if they're dealing with tailbone pain, we need to work anteriorly with the sphincter muscle, posteriorly with the sacrum, and laterally with the coccygeus muscles. And then we can also work with the coccyx and sacral junction, that joint there, if there's any torsions or twists or side bending of the tailbone. That can be helpful there as well. So I hope that was helpful for you all. And please make sure that you are assessing the anal sphincter complex, the sacrum out of flexion, if you have anybody dealing with tailbone pain. All right. Thanks everybody for listening in. Here is to smoother births, faster recoveries, and less tailbone pain for our clients. Take care, everybody. We'll see you on the next episode. Please share this episode with any of your colleagues.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.